बियर बाइसेप्स बात करता है भूतों के बारे में एंड सुशी टॉक्स बात करेंगे आज विद डॉक्टर अस्मिता यादव. सो हेलो मैम लेट्स स्टार्ट द कॉन्वर्सेशन. मैम, first question is PCOS, polycystic ovarian syndrome. Ma'am, what are the signs a person should look out for?
Okay, so first, thanks for having me here.
Yes, ma'am.
And about PCOS, it's a hormonal condition. So what you will be looking out for is hormonal changes. First of all, the menstrual cycles will be irregular. Second, irregular as it mostly people get like every 21 to 35 days. So cycles you might miss two cycles, 3 cycles. Secondly, people sometimes have a lot of acne, a lot of facial hair, chest hair, forearms, excessive hair growth on forearms. So that is also there. Then weight gain, inability to lose weight. All of these things compound to this. So this is, I'm talking about adolescent females. Later on, people who are trying to conceive, they might encounter problems with conception because cycles are irregular, ovulation is not happening, so they might encounter that. So all of these things one should be on a watch
So,
for.
ma'am, what should be a particular diet plan that a PCOS patient should have? And is there any management of PCOS?
Okay, so PCOS, basically we get a lot of students who come with they come outright saying that they have PCOS. So I feel it's not like there should not be any stigma around it, and people should be educated enough that it's mostly a lifestyle problem. And by doing certain modifications in your diet, and not very big changes, just avoid junk food, avoid excessive sugar, artificial sweeteners or excessive oil. Just keep your diet healthy, regular, जो घर पे हम लोग खाते हैं. Just keep it simple. The diet, everything about PCOS and anything health related, keep it simple. And mostly aerobic exercise. If you're somebody who leads a very sedentary lifestyle, I feel it helps if you just start, going on walks, some light stretching, just incorporate little movement in your day-to-day life, and I feel that goes a long way.
Okay, ma'am. Ma'am, तो अगर आपके पास कोई PCOS का patient आया है, so what are the drugs that are used to treat PCOS?
So, see, first of all, PCOS comes in different age spectrums. So, you have to figure out what you want to treat. So, it's very patient specific, what problem they have come with. Some people are okay with the regular cycles. Young females who are not trying to conceive are okay with the regular cycles. So, that's a different issue. If they are coming with maybe like acne or lots of hirsutism or unable to lose weight, so first you have to rule out other conditions. Sometimes you have to test for their thyroid levels also. So you have to rule that out. You have to rule out any genetic predisposition, any insulin resistance. If they are having like family history of diabetes, if they themselves, so you should get that tested as well.
CAHP, I think एक differential diagnosis होता है ना, congenital adrenal hyperplasia, if I'm not wrong.
That comes very early on, but for them it's a very different spectrum. So you are able to rule that out very initially. But for PCOS, when they come, so it's like, what does the patient want to be treated for? So maybe the acne must be bothering them a lot more. So first, lifestyle modifications, and second, obviously, for acne, what you do, like you refer them to a dermatologist and all that, like it's the one, right? But then thirdly, for hirsutism, there are drugs like spironolactone they use sometimes. I'm saying drug name, but it's not given.
Don't tell the dosages and everything. And अगर आप spironolactone use करोगे as a man, तो आपको gynecomastia हो जाएगा. तो please कभी खरीद.
So there are drugs which can be given for that. Then then if you want to regularize their cycles, you can give OCPs, which also act as a contraceptive. But if you want them to conceive, so there is a mixed balance here to see. So you first regularize their cycle, then make their pattern, tell them to do everything that they can from their side, and then you go for the infertility spectrum.
Okay, ma'am. मेरे को इतना आइडिया नहीं था कि it is such an like individualized approach which is taken for PCOS. Ma'am, let's talk about pregnancy. Okay. So, ma'am, first of all, what are the signs of pregnancy?
Okay.
First, जो सबसे पहला sign आ सकता है.
So I think most people who figure out that they might be pregnant is after a missed period only. But sometimes, people who have irregular cycles cannot notice that sign. So the signs to look out for, like early morning nausea, there can be breast tenderness. Sometimes people experience this increased urge to urinate, like often they would feel that frequently they want to go to the washroom. So these are some signs that one can look out for, and like, you know, aversion to certain type of foods
Okay.
and cravings for certain type of foods. So actually that comes early, like later on in the pregnancy, but initially some people can experience that.
Okay, ma'am. Ma'am, there are a lot of Instagram reels nowadays where females who are like 7 months pregnant, 6 months pregnant are doing exercises. So is it safe to do like gym workouts during pregnancy? And if it is safe, what kind of exercises do you recommend them?
Okay, so again, pregnancy is a very individual process, right? Every woman goes through it differently. So first of all, before, if you are somebody who's always been active, who's been exercising, going to the gym, it's always best to consult with your obstetricians and figure out what works for you. But since you're asking a general question, it's completely okay to exercise as long as you're not doing exercises lying straight back, so that your uterus is lying back on your like blood aorta, IVC, all of that gets compressed. So that should not happen. Then try to do like good mild aerobic exercises. Even weightlifting is completely fine.
Okay.
But it's an individual thing. If the thing to look out for are the warning signs. So if you feel like sudden palpitations, shortness of breath, as in you're not able to breathe properly, suddenly very sweating, if you feel some, you know, watery discharge or abdominal pain, cramping pain, these things one should look out for and then immediately seek help.
Okay, ma'am. Ma'am, what are the foods to eat, like which you recommend during pregnancy? What are the foods that one should avoid during pregnancy?
Okay, so basically, the foods that anybody who will prescribe, like advise somebody to have, is what you have been having pre-pregnancy also is good. You know, there is no strict key, basically you should eat this and not that, but ideally you should have a balanced diet, whole foods, try to like I say, try to avoid excessive junk food, and also some, like these days, because women are getting pregnant a little later on in life, and you know, diabetes and lifestyle diseases are very common. So if they have diabetes and something, so they should avoid those foods. Other than that, there is no particular like stigma that you
Okay,
should
okay,
have
okay.
this and you should not have this, but it should be well balanced diet.
Ma'am, let's talk about stigma. Ma'am.
Sorry.
Sorry.
One more thing I wanted to add on to this is processed meat, like meat, and if you're having fishes and all of this, you should be very careful. So fish can have like excessive mercury and all. So you should
Okay.
like cook it properly and avoid certain, I'm not sure which fishes because I'm a vegetarian, but like certain fishes, like I think mackerel has a more mercury content. So you should avoid those. Then you should avoid these meats. So sometimes they can have like dairy products if they are like old. So watch out for listeria, or you know, certain like all these non-vegetarian food products, you have to be careful with
So
them.
non-veg and poultry ke sath you have
Yeah,
to.
you have to be careful. So you have to be sure where they're coming from and who's preparing them.
So there's a lot of stigma when it comes to HIV positive patients. And ma'am, is it possible for an HIV positive mother to have babies? A, and how do you prevent HIV transmission to a young one?
So HIV has, like I said, mothers definitely do get pregnant. Sometimes post-pregnancy, when they come for the checkup, then only they like we do certain tests, and then you find out that they're HIV positive. So it's completely okay. You start them on antiretroviral drugs, and you maintain the therapy. You maintain the viral load, and as long as that is maintained, the chances of the baby having it are very low. And if the baby has it also, what you have to do is start the baby on antiretroviral therapy as soon as the
We
birth.
give
And even-
nevirapine, no?
yeah, and yeah, that's how I remember ki baby. Something I had tried to memorize a mnemonic of it. Then you also, breastfeeding is also allowed as long as the viral markers are low. So HIV in pregnancy now is a much, like it's tackled very well, especially with the government programs and all.
Okay, ma'am. Ma'am, अब हमने positive के बारे में बात की, let's talk about something negative. So what are negative pregnancies, and why is it an issue?
Okay, so Rh negative basically means what your blood group is. So your blood group, when you say, you can say it's A positive, A negative. So that positive negative factor that you're saying, it's your rhesus factor. So Rh pregnancy, an Rh individual is somebody who lacks that Rh factor. So if it's not there, they are negative individuals. It's not a problem as long as your partner. Okay, I will tell you why it's a problem. So the problem is Rh, if I am A negative, and my partner has a positive blood group. So the chances of me having a baby with the positive blood group are around 50-50, right? So if I have that baby in first pregnancy, actually there's no problem unless there is some excessive bleeding or some traumatic event happens. But first pregnancies in these individuals are safe. But why do you need to educate these people is, so if I have a positive baby and I am negative, my body has not seen that positive. This is exactly the reason why you won't transfuse positive blood group to a negative individual, like blood products to a negative individual. Same, my body has not seen, so my body will form these soldiers called antibodies for that particular baby. So in this, the antibodies that I form for the first time, they have like a long time to act and they are not very strong. So the first baby after birth will be fine. Like during pregnancy, nothing will happen. The problem happens, it's called an amnestic response, like a sleepy response. Second pregnancy when I get, and if the baby is positive, my bodies, those antibodies that were formed will vehemently attack the baby.
Okay.
And that baby can develop severe jaundice, and the most severe condition is hydrocephalus. Basically, the baby will be edematous, can have an immunogenic reaction. So now to prevent that, we give anti-D injections. It costs around 4,000, but once you take it during your first pregnancy, so those antibodies, the weak soldiers that are, they get neutralized.
Very good. Okay, ma'am. Ma'am, what are some drugs, like commonly available drugs around the home that one pregnant female should avoid? And what is teratogenicity?
Okay, so teratogenicity is basically things which can cause. Teratogen actually means cancer-causing substances, but also can cause congenital malformations in the baby, can cause problem in the baby's organ development, liver development, all of these things. So when somebody is planning for a pregnancy and after conception, people should sort of be careful. First trimester, the initial 3 months of pregnancy are the most important months in terms of development of organs and all of these things. So those months one should be careful. One thing that comes to mind is warfarin. So people who have like the syndrome called APLA and all, they are on warfarin therapy. So they should consult their healthcare advisor and ask to switch to other drugs. Secondly, people who have like serious acne, so sometimes they use isotretinoin, that is also carcinogenic, like not good for the baby.
Okay. हाँ, उनको 1 to 3 months का एक period देते हैं कि इसके बाद ही आप conception
Exactly. So, but ideally, when your doctor is going to start you on such a medication, they usually counsel accordingly that if you're planning to get pregnant, please come for counseling like that. And later on in pregnancy, if you have like hypertension, you should not take like these ACE inhibitors and ARBs. That your doctor will again counsel. Secondly, you should avoid if somebody has a seizure disorder. So again, valproate is a drug.
Sodium valproate.
But if you're already pregnant on it, they sort of like continue on it. But that's one drug. Then NSAIDs, I think, is a common drug, like ibuprofen and all these things. Yes. So you should sort of like they are given, but not to be taken like in excess.
Okay.
So those.
Good, ma'am. I think this is a very important topic that we discussed. Ma'am, what is the psychological impact of early pregnancy loss?
Okay. So pregnancy in itself is a very unique and individualistic process. And when a couple goes through something like early pregnancy loss, there are multiple things which go into it. So first of all, it takes a toll on the body, right? An emotional toll because certain expectations are there, and people do, because since nowadays couples are getting married a little later on, so these incidents are also rising, so that is there. Second, if it's the first pregnancy loss, or if it's like a second or third, depending on that. So if it's the first, usually after counseling, patients are usually okay, they can try to conceive again. But after a second or third pregnancy loss, your hopes of everybody these days comes with the mindset that everything should be fine, and if you're coming to a doctor, they will counsel you. But that takes a toll itself. So when that happens, so you have to evaluate accordingly. So sometimes one pregnancy loss, you can counsel them, okay, you try to conceive again. If it's a second or third time, then you have to find out why it's happening. And you have to sit with them and figure out what can be the other causes.
So, ma'am, a lot of females complained about heavy bleeding, light bleeding. So let's talk about abnormal uterine bleeding, and when should a patient come to you?
Okay, so this is like an all age group problem, But usually the problem for this heavy bleeding or excessive bleeding is usually in the later age group, like the later decades of life. So first of all, you should know your bleeding pattern. So some women always have less bleeding, like less number of days, and quantity is also less. And some women usually have a 5-day flow. So one should know what is normal for them, what is routine for them. And if you feel the pattern is varying from according to that, like a few pads, sometimes it's okay because hormonal stress or something. But if you feel that you're using more pads than ever and you're passing big clots or something, and I think the major sign is in all age groups, if you're experiencing fatigue, you're getting tired very easily, things that you used to do routinely, you're having a difficulty doing that. So that is one parameter, that you may be losing like a lot of blood and your hemoglobin is going down. So that is one thing that one should look out for. Then secondly, if you're having very frequent cycles, like every 10th or 15th day you are starting to bleed, you're bleeding for like more than your normal days. And in those days also, like the bleeding is more. So that you have to definitely watch out for. And then you should go to your gynecologist and seek out help. Like, why is it happening? And especially, I think abnormal bleeding is a problem post-menopause. Some women experience post-menopausal, they will have bleeding. So that definitely has to be evaluated. So because perimenopausal anyway, the cycles become irregular. So sometimes they can't gauge. If a period has not come for 3-4 months, when it comes later, the bleeding is usually heavy. But they are already seeking treatment. These women like who are old and postmenopausal since 10-15 years, sometimes if they have bleeding, that can be missed. So caregivers should watch out for that. So
Okay, ma'am. Postmenopausal bleeding may, like, it is, I think, endometrial CA or something like that, no? CA.
So it's like this. You don't jump onto
Yes,
that.
ma'am, I'm
So
so
most common cause of postmenopausal bleeding is usually atrophic endometritis. But the most serious thing which can happen, because it's definitely a carcinogenic etiology. So that's why you need to find out. If it's a routine thing, mostly it is because of like these benign conditions, but you should get evaluated just in case it is something malignant.
Okay, ma'am. Ma'am, let's talk about infertility, and why do you think it is rising in like both men and women?
Okay, so yeah, infertility is a booming topic and a booming business as well. And the first answer for anything is lifestyle changes. First of all, the lifestyle has become sedentary, our diet habits are different, and most couples are getting married at a later age in life because career is there and a lot of family personal choices, and everybody wants to plan it that way. So as the age advances, more so for women, the quality of their eggs, and they also get like lots of metabolic diseases. Your chances of getting hypertension, diabetes, all these things are more at an advanced age. So that becomes. So these are the things which are contributing to that. So these things only.
Ma'am, smoking and vaping, do they cause infertility?
Like now research shows that yes, there is a significant contribution of smoking. Vaping, there is not much evidence because it's a very recent thing. So not many research has been conducted, but I'm sure like they have found out that there are certain chemicals in these vaping liquids which
Ethylene glycol is there, a lot of.
so like these things, they are causing some oxidative stress in the body, basically putting your body under stress. So that can cause, and smoking definitely, it causes inflammation, it causes vasoconstriction, it causes decreased blood supply to all the major organs. So it is a known fact now that smoking definitely is a risk factor for infertility. And if somebody is smoking, it's ideally they're advised to smoke stop smoking for both partners at least 3 to 6 months before they want to conceive. So that's approximately the time it takes, but the ideal is not to smoke it.
याद रखूंगा. Thank you, ma'am. Ma'am, abortion. What is your take on abortion? And tell me like some instances, कुछ patients जिन्होंने बहुत ही अजीब तरीके से abortion करने की कोशिश करी है.
So I think when we are talking about abortion, we are talking about abortion in females who are not married, or like the outside of married abortion, because like inside marriage when they happen, the social approach and the medical approach to that is different. Whereas I feel like in Indian society, the approach to unmarried females getting abortions is different. So the two abortions, one is spontaneous abortion if it's happening on its own, and second is whether you are terminating the pregnancy. So
abortion and miscarriage में क्या फर्क होता है?
the medical term is abortion and layman term is miscarriage. So but miscarriage is also it happens on its own, like miscarrying, you're carrying and you miss it, so that's miscarriage. But abortion can be like different, as spontaneous, medically induced abortion. So which one are you talking about?
मैम आप थोड़ा सबके बारे में बता दीजिए.
Okay, so spontaneous abortions are abortions which happen, like you were saying, early pregnancy loss. So these are the ones which happen like initial 7 weeks of pregnancy, 6 weeks, 8 weeks, where when this happens, they will spontaneously start bleeding, or sometimes they go to the doctor and the heartbeat is not there. So that time, that's an abortion. Secondly, if a family, like, for planning the family, if they want to have some gap between children, so their failure of contraception is an indication, according to Government of India, for terminating a pregnancy. So that time you can induce an abortion. That's called a medically induced abortion or medical termination of pregnancy. So that has its own guidelines. So 20 weeks, 24 weeks, like that. So for that. So socially, you have to deal with abortions emotionally, psychologically, and socially. So my take on abortion is this: it's a very very vulnerable spot for any female to be going through that, whether be it inside of marriage or outside of marriage. And I feel like since there is so much social stigma around abortions outside of marriage, so to deal with them, to counsel young adults, even the sexual education that we provide, it should all like educate them about these things, because these over the counter, these tablets to cause abortion, sometimes they are present like over the counter and they're not really hardly regulated. So people can get access to them and they can take them on their own, and it can actually threaten young lives and put them in jeopardy. So these things have to be watched out for and like educated.
Can I ask a very sensitive question?
Yeah, sure.
Ma'am, what happens in cases of sexual assault and rape victims?
Okay, so that in itself is like a legal process is there. So first, all that has to be handled with the police, with female attendants definitely, and the forensic medicine people are the ones who first come into contact with that. And later on, definitely, like I don't have to talk about the the trauma, the mental trauma of it, but definitely if talking about like in a contraception based way, so definitely they are given the contraception, like termination of pregnancies can be done that time.
Yes, thank you so much, ma'am. Let's move on to menstrual health. So what is the difference between a tampon, a menstrual pad and a menstrual cup, and which is better?
Okay, so again, all three are choices a woman can take based on what suits her, what she can afford, and what her beliefs are. So menstrual cup is more sustainable, environmental friendly, because one menstrual cup can, depending on from which brand you're taking, what material it is, can last up to 3 to 5 years and you can use it.
3 to 5 years?
Yeah, some of them come as, you can use them if you're keeping them, taking care of them well. So you can use them for 3 to 5 years, but mostly has to be changed at least like 6 months to 1 year. Whereas like a tampon is a small, how do I describe it? It's like a cotton thing that you have to insert inside the vagina. So you don't have to like frequently change it. But some women may not be comfortable, so they don't prefer to go for it. And some are comfortable with pads. So tampons and pads both have to be frequently changed. One thing that I would like to say is people should know that tampons and menstrual cups, more so with tampons, the risk of toxic shock syndrome is more. So one should never wear a condom and go to sleep. And it should not be worn for more than like 8 to 10 hours. So it should be frequently changed. That is there.
Ma'am, a lot of my female friends and a lot of females in general, ma'am, they take oral contraceptive pills regularly so that contraception is maintained, or like they take that emergency pill jab galti se ho gaya, it was not planned. And what are the harmful effects?
So for oral contraceptive pills, if they have been prescribed to you and if you're taking them in a like regular manner and you're very punctual with it, there are not many side effects, except like some initially when you start taking them, you can have some irregular bleeding, you can have some hormonal things. Some people can develop some acne, so that sort of hormonal response, mood swings can be there. But once it gets adjusted, the risks are not that much. So it's very safe. Secondly, for emergency contraception, and since it's available over the counter, I have heard that people, and we've seen that people do sort of like abuse it and use it frequently. It's an emergency contraception. It's supposed to be taken in an emergency. It's not like you can take it every time happens. If that is happening, at least if more than 2 times or 3 times in a year, you should definitely talk to your healthcare provider and find out what sort of contraception works for you.
Okay, ma'am.
And OCP is a great choice.
Okay, ma'am. Ma'am, let's talk about menopause. So a lot of people, a lot of ladies go through something known as hot flashes. So how do you manage hot flashes, cases of hot flashes?
Okay, so hot flashes are very common, and I think it's the most dreaded component of menopause. So ideally, there is medication that can be given, estrogen, small minimal estrogen therapy can be given for that. And but before going to that, some lifestyle modification. Again, like I say, for everything there is lifestyle modification, so that also helps. But first thing is you just have to like counsel that it's a very short period of time, brief time, then it'll go away. So because first of all, that causes major panic. And I think most women, more than the hot flashes, the mood swings are what causes them a lot of trouble. So minimal estrogen therapy is something that you can talk to your healthcare provider and go for it if it's really bothersome.
Okay, ma'am. Let's talk about, ma'am, sexual health. Okay, so what should be the aftercare for a man and a woman after like normal sexual coitus?
Okay, so first of all, this is considering the fact that it's protected sex and consensual sex. Then afterwards, definitely, I feel like taking care of personal hygiene, washing the genitalia, that is important. But I feel like especially for women, it's very important to urinate, like pass urine after sex, because that helps flush out any bacteria which would have gone up the urinary tract. So that prevents like a lot of problems, especially like urinary tract infections, like burning micturition and all of that. So I think most people don't know that. So that is the most important thing to definitely do.
Okay, ma'am. What should a person do after unprotected sex?
First of all, a person should not have unprotected sex, but like we're talking, it can happen. So you have to find out because chances of pregnancy are always there. So if you're not on regular contraception, like an OCP or something, and you've had unprotected sex, one thing is definitely emergency contraception. So it is available over the counter, so that can be done, but the thing to be noted is it's effective if taken within 72 hours, and by chance if fertilization, if the sperm and ova has already met, so it might not work. So that has to be like kept in mind. And if you're feeling that you've not taken it, there's a delay, so you should definitely talk to like a professional and figure out what are your other options. There are other options also available, and people are counseled accordingly. So
What should a man do?
if they've had unprotected sex,
Yes, ma'am.
you should be supportive, definitely. And I feel like it's a very like engaging conversation to have with your partner. It's okay, so and so happened. So do you, if by chance the person gets pregnant, how do you want to deal with that? If you both of you agree as partners that you don't want it, then how to go about it? And I feel it always helps to be supportive, to be there, because in these issues, if it's an unmarried, like if a couple who's socially not together, so they can face a lot of problem and judgment, and the woman herself, while seeking medical care, can face a lot of problems. So I think just being
Ma'am,
there, being
I would
supportive
like
helps.
I would like you to bust a myth that a lot of men say ki let's have unprotected sex and I will ejaculate outside and it will not cause any pregnancy. Is it true or false?
Withdrawal is a method, but it's not a very
100%.
100% method. And I feel like one should not risk something like a pregnancy for that. It's always better. Contraception, at least barrier contraception, condoms, and all of these things are easily available. So I feel it's always better to, I know some people are not comfortable using these methods, but like I said, the consequences are, I think when two people consent for a sexual activity, they should keep in mind that definitely it's leisurely also, but there are also other repercussions, consequences which can happen. So are you as a couple or friends ready to get into that? If you are, then yeah, using contraception, not using contraception is a shared choice. But I think mostly it's advisable to use it and not rely on.
Yeah, the withdrawal method.
Yeah.
Now, what are signs of sexually transmitted disease in men and women?
Okay, so since now people are using a lot of contraception, the incidence is less, but the signs that one can look out for is maybe a lot of discharge, itching. They can develop like sort of rash or pustules, as in like pus-filled areas, or they can sometimes have these scabs that can form, or like these are the things, because herpes is the most common one.
Okay.
I'm not sure statistically most common or not, but it's one disease that is transmissible like that. So you should watch out for these. And I feel like if you are engaging in regular sexual activity, or if you are at risk for getting sexual transmitted diseases, if you work in those conditions, or if you have multiple sexual partners, so definitely advisable to get tested for the most prevalent conditions at least.
Okay, ma'am. Ma'am, does HIV spread by kissing?
I think this is an age-old question.
Yeah, but like it is.
No, it depends actually on your viral markers, but it doesn't, unless it's coming in contact with blood, it doesn't spread by kissing. But also depends on the viral load marker.
Okay. Okay. Ma'am, you were talking about discharge. So, can you tell different types of discharge based on color, odor, consistency?
Okay, so first of all, people should know what a normal discharge is. I usually, we were talking about sexual health, and I missed out on this point. I would like to get back. Women tend to use all these hygiene products that come. There is no role of these things. Ideally, you should just clean it with normal, plain, lukewarm water, and that's all the area needs cleaning for. So that is there. And odor, some odor, like the normal discharge color-wise is clear or little whitish, like transparent whitish. Odor, it has some odor, it's not odorless. So a person they will know, a female or a male knows what their personal odor is like. Then secondly, sometimes it can become very thick, whitish, which we call candida. That's the most common fungal infection that women get. Sometimes it can become little greenish, so they can get something called a trichomonas. That sometimes they can have like some bloody discharge also because of some itching or some other lesion that is there. So these are the sort of discharges that one should watch out for.
Ma'am, if someone is experiencing post-coital bleeding, what can be the differential diagnosis?
Okay, so again depends on the age group. So first, I think you're asking this question, and when any med student hears postcoital bleeding, CA cervix is the one that comes to mind. But other than that, there are multiple things. So they can have something called a polyp. It's a small mucocutaneous growth that is there. So that can also bleed. Sometimes it's just erosion, like sexual traumatic erosion that can happen. And polyps is there. And CA cervix comes very at the spectrum, latent spectrum of it.
Okay, ma'am. Ma'am, another sensitive topic, but our generation is quite comfortable talking about this. Ma'am, what are safe sexual practices for homosexual people? So they engage in anal coitus. So what should they, think about? What are preventive measures for them when it comes to sexually transmitted diseases?
Okay, so first of all, definitely knowing your partner, and if you're engaging in like activities with multiple partners or something, you should definitely get your serology done regularly, like I said. Secondly, I feel always contraception is important, not just for preventing pregnancy, like I said, it's also for preventing STDs. So condoms are advisable. Then if you're using an adequate lubrication is also advisable. Then if you are taking part in orogenital sex, there is something called a dental dams karke something comes. It's like sort of a film that you can put, and when you're taking, it's not a condom per se, but it's like a polyurethane thing which you apply, and it, like if you're taking part in orogenital sex, you can use that also. It's a little expensive in the country, but as in more people use it, I think it'll become affordable. So that is there. Adequate lubrication, definitely personal hygiene should be maintained. Some people prefer to use these flavored lubricants, so that can sometimes cause irritation to the partner, so that has to be taken care of. And certain measures like douching before getting into this activity, these are some things that can be done.
What are the usual sexually transmitted diseases that one can expect after orogenital sex?
The routine ones only. That the ones that you get with your routine sexual activity, you can get from orogenital sex also. So herpes is very common. Definitely HIV can also be there. If there is trauma happening, then definitely syphilis is also there. So these conditions are prevalent and can happen.
Okay, ma'am. Ma'am, what are aphrodisiacs and do they work?
Okay. So aphrodisiacs are which sort of increase your interest or desire in sexual activity, and there are some natural aphrodisiacs and some synthetic ones. If they work or don't, there is no like solid research on this, because it's I don't think there's much research on this. I'm not sure. I've not searched this, but generally some things like, they have some natural products will have certain chemicals like maybe zinc or boron or like some vitamin E or something, or antioxidants, which will
Shilajit.
just help.
Yeah.
Yeah, so which will just help, with the sexual desire and all of these. Like they say honey and I don't know which else.
Shilajit.
Yes, so basic thing.
Okay, ma'am. Ma'am, let's talk about breasts. So, ma'am, what is colostrum?
I really have to say, let's talk about breasts. Okay, so colostrum is the first milk that a mother expresses after the baby is born. It's very concentrated, it's yellow, and in some cultures it was discarded, so it's not supposed to be discarded. It's very nutritionally good for the baby. It has a lot of protective substances which can protect the baby.
Soldiers.
Yeah, the soldiers, which can protect the baby from infections, which the baby myself. So it's basically mother's antibodies that the mother gives to the baby. So it's the first milk.
So it should not be discarded.
Should not be discarded is the message.
Ma'am, let's say a female has uneven breasts. Should she worry about it?
Most females have uneven breasts. So that is like a very common thing. And unless there is a sudden change in size, shape, texture, or if you feel that there's a sudden swelling, that should be evaluated. But otherwise, having uneven breasts is completely normal. And both men and women should know that.
Okay, ma'am. What should a female do when she experiences a mass in her breast?
Okay, so like you said, most people should know that they should self-examine their breast, and especially after maybe like 30s or 35, they should definitely, earlier also, but definitely after 30, they should start, 35 should examine. And if they feel there is a mass, they should notice how thick it is, whether they're able to move it or not. The first thing is go to a healthcare provider, go to your obstetrician gynecologist, go to a doctor, get that evaluated. And then based on what they tell you, you have to, and especially if you have family history of breast cancer. So that becomes very important. These things, especially women who have family history of breast cancer, should breast examine earlier. And not just women, men also can get breast cancer.
1% of all breast cancers are male breast cancers.
Yeah, so that is also there.
Ma'am, if a female is experiencing pain during breastfeeding, so what can be the cause of that?
Okay, so first of all, usually ideally doctors, obstetricians to their patients, pre-pregnancy, like during pregnancy also, only they start giving them these creams and lotions to apply so that it helps, because the area it's a very sensitive area, it becomes very raw. So they can have it because of some cracks, and maybe if they develop a skin infection, it can become painful. So that should be talk to your obstetrician. And if you feel, if it's a nipple crack, sometimes they can give like these lotions which have just to like make the area heal. So, but it's not a reason to stop breastfeeding. You should express, and if it's very painful, you should express and feed the baby. And if you're putting something, you should always, right before feeding, just wipe it off with a clean cloth and then feed and reapply it again. So that's important.
Ma'am, what advice do you give to patients on the method to breastfeed properly?
Okay, so this is very important. Young mothers, the mothers who become pregnant for the first time, they usually don't know how to breastfeed. So ideally, I think it's a very common question which they teach to med students, but ideally they should be sitting in a calm, quiet place, whichever comfortable, sitting or lying down, which is comfortable for them. They should hold the baby's head till the baby, so that the baby latches on, at least the nipple is there and the areola is there. Sometimes what happens is the baby will not latch properly. Latching means the baby's mouth should cover at least the 3/4 of the areola. Areola is the brown tissue surrounding the nipple. So that should happen. And obviously after feeding the baby, you should see for signs of like adequate breastfeeding. So baby is passing urine, baby is falling asleep. So these things are also important.
Okay, ma'am. Ma'am, तो हमारा एक last segment है, guess the diagnosis, ma'am. So, ma'am, this is the first image. आपके हिसाब से ये क्या है?
Okay, so this looks like multiple vesicles. Mola pregnancy?
Yes, ma'am.
Complete mole, maybe.
Yes. तो थोड़ा सा बता दीजिए आप audience को what is molar pregnancy?
So molar pregnancy is like I said, it's a pregnancy. You conceive it naturally only, but sometimes there's a fault inside the egg or genetics of the egg or the sperm. Based on that, the development of the fetus, they meet, but the development is not normal. So what happens is usually the trophoblast, usually in a normal pregnancy, trophoblast gives rise to placenta. And so it has like cytotrophic, I won't go into much detail. Yes. But what happens is, so the normal development of a baby does not happen, and just fluid filled vesicles start forming. So that's called a molar pregnancy. The fluid filled vesicles are commonly seen in a complete mole, and there's also something called a partial mole. the thing one should know is if that happens, so these people usually come with like initially bleeding, or if later in the pregnancy passing of these grape-like vesicles, like grape-like things through the vagina. So the thing is, you should always follow these patients up for their serum beta HCG, and there is a certain risk of malignancy associated with them. So that should always be kept in mind. So if you're somebody who's had a molar pregnancy, so later on, so that can happen. So that history is important. So a person should know this and tell their next doctor if they're changing
Okay, ma'am. I'll show you an ultrasound image now. What is this?
Okay, this is a string of,
Yes,
so
ma'am.
this is a PCOS ka classical picture. It's a development of multiple follicles instead of one.
Is it necessary for diagnosis of PCOS?
No, it is not. It is
Okay,
not.
ma'am. Ma'am, last image, ma'am. What is this?
Okay, this is a fibroid uterus.
Yes, ma'am.
So this is
Wow,
a very
ma'am.
common occurrence.
And इसमें वही palm coin वाला
Yeah,
अपना
palm coin comes into this, and you have to. This is a common cause of like dysmenorrhea and heavy menstrual bleeding. Later develops mostly beyond 40, 45 perimenopausal women. So usually they regress after menopause.
Okay, ma'am. Ma'am, today it was a wonderful experience talking to you and picking your brain, ma'am. I've learned so much about obstetrics and gynecology, and hopefully the viewers have like learned a lot about sexual health, menstrual health, do's and don'ts, and hopefully you will be back for another episode, ma'am, and we'll get into the details of all these diseases, ma'am. मेरे को 1 घंटे का full PCOS episode चाहिए, ऐसा सब कुछ चाहिए, ma'am. Thank you so much, ma'am.
Thank you so
And
much for having me. Thank
Sushi
you.
Talks will be airing soon. Thank you so much.